Systematic review. What is a systematic review? This is the review which is defined as a assess of research on the topic. A systematic review extract and interpreted data from published studies on the topic in the scientific literature, then analyze, describe, critically and summarize interpretation into a refined evidence based conclusions. For example, a systematic review or randomized controlled trials is a way of summarizing and the implementing evidence based on medicine. Here is the scientific evidence. The first is meta-analysis and systematic review. This is the table of systematic review is considered to the most trusted form of evidence. While systematic review may be applied in the biomedical or healthcare context, it may also be used where an assessment a precisely defined subject can advance understanding in the field of research. Systematic review may examine clinical tests, public health intervention, environmental interventions, interventions, adverse effect, qualitative evidence, synthesis, methodological review, policy review, and economic evaluation. Systematic review are closely related to meta-analysis, and often the same instance will combine both being published with subtitle, a systematic review and meta-analysis. The disconnection between the two in that meta-analysis use statistical method to induce a single number from the pooled dataset such as effect size, whereas the strict definition, a systematic review excluded that step. However, in the practice, when one is mentioned, the other may uh, often be involved, as it takes a systematic review to assemble the information that a meta-analysis, and people sometimes refer to an instance as a systematic review even if it includes the meta-analytical component. And understanding a systematic review and how to implement them and the practice is common for professionals in healthcare, public health, and public policy. Systematic review contrasts with the type of review often called a narrative review. Systematic review and narrative review both review the literature, but the term without the further specification refer to a narrow review. Characteristic. A systematic review can be designed to provide a thorough summary of current literature relevant to a research question. A systematic review used a religious and transparent approach to research synthesis with the aim of assessing and where possible minimizing bias in the finding. While many systematic review are based on explicit quantitative meta-analysis of available data, there are also quantitative review and other type of mixed method review which adhere the standard for gathering, analysis, and reporting evidence. The systematic review of quantitative data and mixed method review sometimes use statistical technique meta-analysis to combine result of eligible studies, storing level, and sometimes used to rate the quality of evidence depending on the methodology used. Although this is the discouraged by the Coranach library, as evidence rating can be subjective, multiple people may be consulted to resolve any scrolling difference between how evidence is rated. The EPPI Center, Korcharna, and the Jonah Bring Institute have been influential in developing methods for combining both qualitative and quantitative research in systematic review. Several reporting guidelines exist to standardized reporting, but how systematic review are conducted. Such reporting guidelines are not equally assessment or appraisal tool. The preferred reporting items, systematic review, and meta-analysis statement suggest to standardize way to ensure a transparent and complete reporting of systematic reviews. And It now required for this kind of research by more than 170 medical journals worldwide. Several specialized PRISMA guideline extension have been developed to support particularly type of studies of aspect of the review process, including PRISMA P for views protocol or Prisma SCR for scoping review. A list of Prisma guideline extension is hosted by the Equator, enhancing the quality and transparency of health research network. However, the Prisma guideline have been founded to be limited to intervention research, and the guideline have to change in order to fit non-intervention research. As a result, non-interventional report reproducible and open systematic review was created to counter this limitation. For qualitative review, reporting guideline including inter-review enhancing transparency in the reporting the synthesis of qualitative research. For qualitative evidence synthesis, precise relies and meta-narrative evidence synthesis involving standards for meta narrative and realizing review, and e-meta improving reporting to meta anthropology to meta anthropograph. Development in a systematic review during the 21st century included a realistic review and the meta narrative approaches, both the which address problem of variation in method and heterogeneity exist on the some subject type. There are over 30 types of systematic review, and table 1 below non exhaustively summarize some of these. There is no always consume the boundaries and distraction between the approaches described below. Table 1, a summary of some of the type of systematic review. Review type and summary. Mapping review, systematic map. A mapping review maps existing literature and categorize data. The method characterizes quality and quality of literature, including by study design and other features. Mapping review can be used to identify the need of primary or secondary research. Meta-analysis. The meta-analysis is a statistical analysis that combines the result of multiple quantitative studies. Using statistical method, results are combined to provide evidence from multiple studies. The two types of data generally used for meta-analysis in health research are individual participant data and aggregate data such as ad, radio, or relative risk. Mixed studies reviewed mixed method review refer to any combination of method where one significant stage is a literature review, often systematic. It can also refer to combination of review approaches such as combining quantitative with qualitative research. Quantitative systematic review, qualitative evidence synthesize. This method is integrated or compare findings from qualitative studies. The method can include coding the data and looking for themes or construct across studies. Multiple authors may improve the validity of the data to potentially reducing individual bias. Rapid review. An assessment of what is already knows about policy or practice issues which used systematic review method to search for any critically appraises existing research. Rapid review are still a systematic review. However, part of the process may be simplified or omitted in order to increase rapidity. Rapid reviews were used during the COVID-19 pandemic. Systematic review, a systematic search for data using the repeatable method. It include appraising the data, for example, the quality of the data and synthesis of research data. Systematic research and review combined method from a critical review with a comprehensive search process. The review type is usually used to address broad questions to produce the most appropriate evidence synthesize. The method may not include the quality assessment of data sources. Systematically review including element of systematic review process, but searching is often not as comprehensive as the systematic review and may not include quality assessment of data sources. Scoping reviews. What is the reviews? Scoping reviews are distinct from the systematic review in a several ways. A scoping reviews is an attempt to search for concept by mapping the language and the data which surrounded those concepts and adjusting the research method it iteratively to synthesize evidence and assess the scope and area of the inquiry. This can mean that the concept search and method, including data extraction, organization, and analysis, are refined throughout the process, sometime requiring deviation from any protocol or original research plan. A scoping review may often be preliminary stage before a systematic review, which scope out an area of inquiry and maps the language and key concept to determine if a systematic review is possible or appropriate, or to lay the groundwork for a full systematic review. The goal can be assess how much data or evidence is available regarding to certain area of interest. This process is further complicated. It is mapping concept across multiple language or culture. As scoping review, scholar be systematically conducted and reported with the transparent and repeated method. Some academic publishers categorize them as a kind of systematic review, which may cause confusion. Scoping review and helpful when it is not possible to carry out systematic synthesis of research finding. For example, when there are no published clinical trials in the area of inquiry. Scoping review are helpful when determining it is the possible or appropriate to carry out the systematic review, and are useful method when the area of inquiry is based broad. For example, exploring how the public are involved in all the stage systematic review. There is still a lack of clarity when defining the exact method of scoping review, as it is both an illiterative process and it's still relatively new. There have been several attempts to improve the standardization of methods. For example, WISE are preferred reporting items for the systematic review, and meta analysis, PRISMA, guideline, extension for scoping review. The International Prospective Register of Systematic Review does not permit the submission of protocol or scoping the review, although some journal will publish protocol for scoping review stages. While there are multiple kind of systematic review method, the main stage of review can be summarized as follow. Defining the research question. Some reported that the best practice involved defining the answerable questions and publishing the protocol of the views before the initiating it to reduce the risk of unplanned research duplication and enable to transparency and consistency between the methodology and protocol. Clinical review of quantitative data are often to structure using the mnemonic PISO, which standard for popular or problem intervention and exposure comparison and outcome, which other variation existing for other kind of research. For quantitative review, PICO is a population of problem insert and context, searching for sources. Relevant criteria can include selecting research that is of good quality and answer the defined question. The search strategy should be designed to retrieve literature that matches. The protocol specify inclusion and exclusion criteria. The methodology section of a systematic review should list all of the dataset and citation indices that were searched. The title and abstract of identified articles can be checked against the predetermined criteria for eligibility and relevance. Each including study may be assigned an objective assessment of methodological quality, preferably by using methods conforming to the preferred reporting item. For the systematic review and meta-analysis, PRISMA statement or standard coordinate. Common information sources used in research including scholarly dataset of peer-review articles such as Medline Web of Science, Embassies and PubMed, as well as the source of unpublished literature such as clinical trial registries and grey literature collection. Key reference can also be yielded through the additional methods such as citation, searching, reference, list checking related to search method and called peerly growing. Manually searching information source is not indexed in the major electronic dataset, sometimes called hand searching, and directly contacting expert in a field. To be systematic research must be a combination of search skill and tools such as the dataset subject, handline, keyword searching, booleans, operator, and proximity searching, while the attempting to a balance sensitivity, systematic and precision, accuracy, inviting and involving an experienced information professional or librarian can improve the quality of systematic review, search strategies, and reporting. Extraction of relevance data. Relevance data and extracted from the data sources according to review method. The data extraction method is a specified to kind of data, and data extraction and outcomes is only relevant to a certain type of review. For example, a systematic review or clinical trial might extract data about how the researcher was done. After calls the method of intervention, who participant in the research including how many people, how it was paid for example funding sources and what happened, the outcomes relevant data are being extracted and combined in an intervention effect review where a meta-analysis is possible, assessing the eligibility of the data. This stage involves assessing the eligibility of the data for inclusion in the review by judging it against criteria identified at the first stage. This can include assessing if a data source meets two eligibility criteria and recording why the decision about inclusion or exclusion in the review more made. Software can be used to support the selection procedure, excluded text mining tool and the matching learning which can automate respect on the process. The systematic review textbox is a community driven web based catalog of tools to help reviewer those appropriate tool for reviews. Analysis and combine the data. Analysis and combining the data can provide an overall result from all the data, because the combined the result may use qualitative or quantitative data from the eligible sources of data. It is considered more reliable as it provides better evidence. As the more data included in a review, the more confident we can be. Conclusion: when appropriate, some systematic review including a meta-analysis with use statistical method to combine data from multiple sources. A review might use quantitative data or might employ to quantitative meta synthesize with synthesized data from qualitative study. A review may also bring together the finding from quantitative and qualitative studies in a mixed method or overreaching synthesis. The combination of data from the meta-analysis can sometimes be visualized on the meta use of forced plot, also called the bloblogram. In an intervention effect reviews, the diamonds in the forest plot respondent, the combined result of all the data included. An example of the forest plot in the coherence collaboration logo. The logo is the forest plot of one of the first reviews, which shows that corticosteroid given to women who are about to give birth prematurely can save the life of the newborn child. Recent visualization innovation include the albatross plot, which plots p-value against sample size with approximate effect size contours superimposed to facilitate analysis. The controllers can be used to enter effect size for studies that have been analyzed and reported in a diverse way. Such visualization may have advantage over the type when reviewing the complex intervention, communication, and the dissemination. On this stage are complete. The review may be published, disseminated, and translated into practice. After being adopted as evidence, the UK National Institute of Health Research defined dissemination as getting the finding of research to the people who can make use of them to maximize the benefit of the research without delay. Some users do not have time to invest in the reading large and complex document and may lack awareness or be unable to assess newly published research. Researchers are therefore developing the skill to use creative communication methods such as illustration, blog, biographic, and broad games to share the finding of systematic review. Automation. Living the systematic review are a newer kind of semi-automated, up-to-date online summarized of the research that are updated as new research become available. The differences between a living systematic review and a conventional systematic review is the publishing format. Living systematic review are dynamic representation online evidence summarized which are updated rapidly and frequently. The automation of the semi automation of the systematic process itself is increasingly being explored, while title evidence exists to demonstrate it is as the accurate of involves less manual effort that prompt training and using artificial intelligence for the process are increasingly. Research field health and medicine. Current use of systematic reviews in medicine. In this article, we'll talk about the systematic review in a research field, and here the author taken particular one field that is a health and medicine. We'll talk. Many organizations around the world use systematic review, with the methodology depending on the guideline being followed. Organizations which use systematic review in the medicine and human health include the National Institute for Health and Care Excellence. We call it NICE UK, the Agency of the Healthcare Research and Quality, and the World Health Organization, most notably amount of international organization in corona in a group of over 37,000 specialists in healthcare who systematically review randomized trials of the effect or prevention, treatments, and rehabilitations as well as the health system intervention. They sometimes also include the result of other type of research. Coherence review are published in the Coherence dataset of systematic review section of the library. The 2015 impact factor for the Coherence dataset of the systematic review was 6,6103 and it was ranked 12th the medicine journal and internal category. There are several type of systematic reviews including the number 1 intervention review assess to benefit and harm of the intervention used to healthcare and health policy. Diagnosis test accuracy review assess how well the diagnosis test perform in a diagnosing and detecting a particular disease. For conducting diagnosis test accuracy review free software such as meta dta and cast hsroc in the graphical use of interface is available. Methodology review address issues relevant to how systematic review and clinical trial are conducted are reported. Qualitative review synthesize qualitative evidence to address questions or aspects other than effectiveness. Prognostic review address the probable courses of further outcome of the people with the healthcare problem. Overview of systematic review compiles multiple pieces of evidence from systematic review into a single accessible document, sometimes referred to as unbreakable review. Living systematic review are continually updated, incorporated relevant new evidence as it become available. Rapid review are form of the knowledge synthesis that accelerate the process of conducting a traditional systematic review through the streamlining or omitted specified method to produce evidence for stakeholder in a resource evidence manner. A review and complex health intervention in complex system are to improve evidence synthesis and guideline development. Patient and public involvement in a systematic review. Further information. There are ways patient and the public can be involved in producing systematic review and other output. Tasks for public member can be organized as entry level or higher tasks include joining a collaborative volunteer effort to help categories and summarize healthcare evidence, data extraction and risk of bias assessment, transaction of reviews into the language. A systematic review of how people were involved in a systematic review aimed to document the evidence based relative relating to stakeholder involvement in systematic review and to use of evidence to describe how stakeholders have been involved in a systematic review. Third, percent involved patient and career. The active framework provide a way to describe how people are involved in a systematic review and many to be used as a way to support systematic review authors in a planning people involvement standardized data of initiative in another proposed way to reporting to has been involved in which task during the research including systematic reviews. There has been some criticism of how Cornell has prioritized systematic review. Cornell has a project to involve people is helping identify research prioritize to inform Cornell's review. In 2014, the partnership was formalized. Let's talk about the environmental health and toxicology. Systematic review are the relatively recent innovation in the field of environmental health and toxicology, although mooted in the mid 2000s. The first full framework for conduct or systematic review of environmental health evidence were published in 2014 by the US National Toxicology Program offline of health assessment and translation and the navigation guide at the University of California San Francisco program on reproductive health and environment. Uptake has since been rapid with the estimation number of systematic review in a field of doubling since 2016 and the first census recommendation on the best practice as the procedure to a more general standard being published in 2020 social behavior and educational. In 1959, social scientist and social work educator Barbara Wharton published one of the first contemporary systematic review or literature on antisocial behavior as a part of the work Social Science and Social Pathology. Several organizations use systematic review in a social behavior and educational areas of evidence based on policy, including the National Institute for Healthcare and Excellence, Social Care Institute for Excellence, the Agency for Healthcare Research and Quality, the World Healthcare Organization, the International Initiative for Impact Evaluation, the Jonah Bridge Institute, and the collaboration. The quiet standard for the systematic review in a social science is based on the procedure proposed by the collaboration with the one of several groups promoting evidence based on policy in the social science. Other some attempt to transfer the process from medicine to business research have been made, including a step-by-step approach and developing a standard procedure for conducting the systematic literature review in a business and economics. Systematic review are increasingly prevalent in other fields such as international development research. Subsequently, several donors, including the UK Department for International Development, are focusing more on testing The appropriateness of systematic review is in assessing the impact of developing the humanities and interventions. The collaboration for environmental evidence has a journal titled Environmental Evidence, which published systematic review protocol and systematic map on the impact of human activity of the differentiateness of management intervention. Review tool, a 2022 publication identified 24 systematic review tool and ranked them by including of 30 features deemed most important when performing a systematic review in accordance with the past practice. The top 6 software tools with at least 21 to 30 key features all proprietary paid platform, typically web based, are included. Gito compliance, these are the paid software. The Cronahans collaboration provide a handbook for systematic review of intervention which provide guideline to author to the preparation of Cronahans intervention review. The Cronahans handbook also outlines steps for preparing a systematic review and form of basic of two set of the standard for the conducting and reporting of the Cronahans intervention review. MECIR methodological expectation of Conahan's intervention review is also the context guideline on integrating patient report outcome into review. Limitation, outdated or risk bias. While systematic review are regarded as the strongest form of evidence, a 2003 review of 300 studies found that not all systematic review were equally reliable and that their reporting can be improved by the universally agree upon set of standard and guideline. A further study by the same group found that of the 100 systematic review monitored, 7% needed updated at the time of publication, another 4% within the year, and another 11% within the 2 year. This figure was higher in a rapid changing field or medicine, especially cardiovascular cardiovascular medicine. A 2003 study suggested that extending the search beyond the major dataset, perhaps into grey literature, would increase the effectiveness of review. Some authors have highlighted problem with systematic review, particularly those conducted by Crorans Crorani, nothing that published review are often biased, out of date, and excessively long. Cronani review have been criticized as not being sufficiently criticized in the section of trial, including too many of low quality. The proposed several solutions, including limiting studies in meta-analysis and reviews to register clinically trial requiring the published data. Some of these difficulties were noted as early as 1994. Much poor research arises because researchers feel complied for career reason for carry out research that they are ill equipped to platform and notably stop them. Methodological limitation of meta-analysis have also been noted. Another concern is that the method used to conduct a systematic review are sometimes change one researchers seen the available trial they are going to include. Some websites have described interaction of systematic review and published report of studies included in a public systematic review. Eligibility criteria that is arbitrary may affect the perceived quality of the review. Limiting reporting of the data from human studies. The All Trial campaign report that around half of the clinical trials have never reported result and work to improve reporting. Positive trials were twice as likely to be published as those with negative result. As of 2016, it is legal for profit companies to conduct clinical trial and not published a result. For example, in the past 10 years, 8.7 million patients have taken part in a trial that have not published result. This factor means that it is likely there is a significant publication bias with only positive or perceived favorable result being published. A recent systematic review of industry sponsorship and research outcome conducted that sponsorship of drugs and device studies by the manufacturing company leads to more favorite efficacy result and conclusion than sponsored by other sources, and that existence of any industry's bias cannot be explained by standards risk of bias assessment. Poor compliance with the reporting guidelines. The rapid growth of systematic review in recent years has been accompanied by the attended issue of poorly compliance with guidelines, particularly in areas such as declaration of registered study protocol, funding sources, declaration, risk of biased data, issues resulting from data abstraction, and description of clearly study objective. A host of studies have identified weakness in a rigorous and reproducibility of such strategies in systematic review. To remedy this issue, a new PRISMA guideline extended called PRISMA is being developed. Furthermore, tool and checklists to peer reviewing research strategy have been created, such as peer review of electronic search strategies and guidelines. A key challenge is for using the systematic review in clinical practice and healthcare policy is assessing the quality of given review. Consequently, a range of ap- appraisal tools to evaluate systematic review have been designed. The two most popular measurement instrument and scoring tool for systematic review quality assessment are Amestra to a measurement tool to assess the methodological quality of systematic reviews, and Robi's risk of bias in systematic review. However, these are not appropriate for systematic review type. Let's talk about the history. The first publication that is now recognized as equivalent to modern systematic review was a 1753 paper by James Linked, which reviewed all of the previous publication about survey. Systematic review appeared only supposedly unti- uh, uh, until the 1980s and become the common after 2000. More than 10,000 systematic review are published each year. History of medicine. In 1904, British Medical Journal paper by Carl Pearson called data for several studies in the UK, India and South Africa of type typhoid inclusions. He used a meta-analysis approaches to aggregate the outcome of multiple clinical studies. In 1972, Archie Corana wrote, "It is surely a great criticism of our profession that we have not organized a critical summary by specially a subsequently adapted periodically of all relevant randomized controlled trials, critical appraisal, and systematics of research finding in a systematic way emerged in 1957 under the term meta-analysis. Early syntheses were conducted in a broad area of public policy and social intervention, with systematic research synthesis applied to medicine and the health, inspired by his own personal experience as the senior medical officer in a prisoner of war campaign. Archie Cornahut's work to improve the scientific method in a medical evidence. His call for the increased use of randomized controlled trial and systematic review lead to the creation of the Cornahut's collaboration, which was founded in 1993 and named after him, building on the work by Lane Kalmerers and colleagues in the area of pregnancy and childbirth. See also. This is all about the systematic review.